One of the most exciting things about radiopharmaceuticals is that we can treat prostate cancer and the patients still feel good while they're getting the therapy.
Theranostics is a term that's used a lot. And typically it's used like a radiotheranostics specifically. And that's kind of a combination of radio is radioactive and theranostics is therapy. Theranostics is this concept of giving a drug that is labeled with a radioactive isotope that is going selectively to the cancer, and that allows you to both image and treat cancer.
The medicine can be for diagnosis or therapy. One of the most famous ones, it's about 80 years old, it's radioactive iodine. So you think of the iodine we put in our salt. There are naturally occurring radioactive forms of that iodine. And it's kind of like a magic bullet because it only goes to cells of the thyroid. So it turns out that if the thyroid is malfunctioning or is cancerous, you can use radioactive iodine to kill it.
Every cell has thousands of different molecular expressions. And is there something that's unique to a prostate cancer cell or any other cancer cell that's not expressed in the rest of the body? So that if we can then target it, similar like a lock and key, we will target exclusively the prostate cancer and we'll leave the rest of the body alone. And why we like this is these treatments are usually very well tolerated. There's usually very few side effects, so you have a good quality of life.
One of the claim to fame of these drugs is that they're low toxicity. Why? Because we can design them to stick to the cancer and try to avoid the other things that the radiation could injure.
The administration itself is under 10 minutes. There's no pain. You don't need to be hooked up to a bunch of different tubes. You administer the drug and then they go home and go get lunch or do whatever else they want to do.
One of the most exciting things is when you give a patient like that a lutetium-based radiopharmaceutical, which is now one of our approved drugs, 80 to 90% of them say, within a few days to a week, I felt much better. And it shocks the tumor, it radiates the tumor, they stop producing those hormones.
What I have come to love about nuclear medicine or nuclear radiology is that immediate understanding of how the drug is interacting with the body. And there is this kind of terminology, if you can see it, you can kill it. And that sounds kind of barbaric, but that's ultimately what we want to do with cancer.